HESI Exit Medical Surgical Nursing, Mastering the Renal and Urinary System. Introduction. Welcome to our comprehensive review of the renal and urinary system for the HESI Exit exam. Today we'll cover understanding renal and urinary system anatomy and function, recognizing common renal disorders and interventions, applying critical thinking in renal emergencies. This system is essential because the renal system maintains homeostasis, fluid balance, and waste elimination. Nurses play key roles in managing fluid electrolyte imbalances and renal disorders. Renal system anatomy and functions. Let's explore the structure and vital functions. Main organs: kidneys, ureters, bladder, and urethra. Essential functions of the kidneys: blood filtration and waste removal, fluid and electrolyte balance maintenance, acid-base regulation, blood pressure regulation through the RAS system, erythropoietin production for red blood cell formation. Key diagnostic tests. Important tests for renal and urinary assessment. Laboratory tests. Serum creatinine, normal range 0.6 to 1.2 mg/dl, indicates kidney function. Blood urea nitrogen, normal range 7 to 20 mg/dl, reflects waste filtration. Glomerular filtration rate, normal greater than 90 milliliters per minute. Urinalysis, identifies infection, protein, and blood in urine. Imaging studies. Renal ultrasound, detects kidney stones and masses. CT scan or MRI, identifies tumors and obstructions. Cystoscopy, provides direct visualization of the bladder. Urinary tract infections. UTIs involve bacterial invasion of the urinary tract. Risk factors. Female anatomy, poor hygiene, urinary stasis, and catheter use. Symptoms to recognize: painful urination, frequency, urgency, cloudy urine, and fever if systemic. Nursing interventions. Increase fluid intake significantly. Administer prescribed antibiotics like Bactrim or nitrofurantoin. Educate on proper perineal hygiene techniques, especially wiping front to back. Pyelonephritis, kidney infection. Pyelonephritis occurs when untreated UTI spreads to the kidneys. Symptoms include flank pain, fever, chills, nausea, and tenderness at the costovertebral angle. Serious complications: sepsis and permanent kidney scarring. Nursing interventions. Administer 4 antibiotics and provide pain management. Monitor kidney function through BUN and creatinine levels. Encourage adequate hydration. Acute kidney injury. AKI represents sudden kidney failure with 3 main categories. Causes by category: prerenal, dehydration and shock conditions. Intrarenal, nephrotoxic drugs and infections. Postrenal, obstruction from stones or tumors. Symptoms to monitor: decreased urine output, fluid overload, and electrolyte imbalances. Management priorities: identify and treat the underlying cause. Monitor electrolytes carefully, especially for dangerous potassium levels. Consider dialysis for severe cases. Chronic kidney disease. CKD involves progressive kidney function decline over time. Common causes: diabetes, hypertension, and chronic infections. Disease stages based on GFR. Stages 1 to 2, mild kidney damage. Stages 3 to 4, moderate to severe function decrease. Stage 5, end-stage renal disease, requires dialysis or transplant. Symptoms develop gradually: fatigue, swelling, electrolyte imbalances, and anemia. Management strategies: control blood pressure and blood glucose levels. Follow low-protein, low-sodium diet. Initiate dialysis in later stages. Dialysis options. Two main types of dialysis serve different patient needs. Hemodialysis uses a machine to filter blood outside the body. Requires vascular access through AV fistula or graft. Risks include low blood pressure, infection, and clotting. Peritoneal dialysis uses the peritoneal membrane inside the abdomen to filter blood. Requires a permanent catheter in the abdomen. Main risk is peritonitis, a serious abdominal infection. Additional renal conditions. Kidney stones, caused by dehydration, high calcium diet, and infections. Symptoms include severe flank pain, blood in urine, and nausea. Management involves increasing fluids to more than 3 liters daily, pain control, and possible stone removal procedures. Benign prostatic hyperplasia. Enlarged prostate in older men causes urinary retention, weak stream, and frequent nighttime urination. Treatment includes medications like tamsulosin and surgical procedures like TURP. Urinary incontinence. Stress incontinence, leakage with coughing, laughing, or sneezing. Urge incontinence, sudden, strong need to urinate. Overflow incontinence, incomplete bladder emptying. Management includes bladder training, Kegel exercises, and medications. Complex kidney disorders. Nephrotic syndrome. Glomerular damage leads to excessive protein loss in urine. Symptoms include severe swelling, protein in urine, and low blood protein levels. Management requires high-protein diet, monitoring for complications like blood clots, and medications including diuretics and steroids. Glomerulonephritis. Inflammatory kidney disease often following strep infections, lupus, or autoimmune disorders. Symptoms include blood in urine, protein in urine, swelling, and high blood pressure. Management focuses on blood pressure control, diuretics, and low-sodium diet while treating underlying infections. Electrolyte imbalances in renal disease. Kidney disorders frequently cause dangerous electrolyte imbalances. Hyperkalemia, potassium greater than 5.0, can cause dangerous heart rhythms and muscle weakness. Treatment includes Kayexalate, insulin with glucose, and emergency dialysis. Hyponatremia, sodium less than 135, causes confusion and seizures. Treatment involves fluid restriction and careful sodium replacement. Hypocalcemia, calcium less than 8.5, results in muscle spasms and tetany. Treatment requires calcium supplements and vitamin D therapy. Nursing priorities in renal emergencies. Critical nursing actions for renal patients. Fluid balance assessment, daily weights and strict intake/output monitoring. Electrolyte monitoring, watch for signs of dangerous imbalances. Uremia assessment, monitor for confusion, fatigue, and severe itching. Dialysis preparation, prepare patients when kidney function fails. You've now mastered the essential renal and urinary system concepts for the HESI Exit exam. Remember that recognizing early signs of kidney dysfunction is crucial for preventing complications. Proper fluid, electrolyte, and blood pressure management are fundamental to preventing serious outcomes. As nurses, we play key roles in patient education, dialysis care, and monitoring for complications. Keep practicing these concepts and you'll be well prepared for success on your HESI Exit exam. Excellent work on your nursing studies.